We now cross over to Nakuru County to hear from Ruth Sarmwe. As Kevin Mutai pointed out in his report, health workers are raising concern over the surge in COVID-19 numbers. Ruth, what does the Kenya Union of Clinical Officers have to say?
Well, we met earlier on with the representatives from the Kenya Union of Clinical Officers who indicated that we've entered into the second wave of COVID-19 infections, and they say this is the worst wave during the pandemic, and they were cautioning Kenyans on their behavior towards the pandemic, as most Kenyans have been seen to have lowered their guard and, disregarding the mitigation measures of COVID-19, which include washing of hands, wearing of masks, and also keeping social distancing, especially in public gatherings. So as we spoke earlier on to representatives from the Kenya Union of Clinical Officers, they were saying that across the country, over 310 clinical officers have been infected during the past month, and sadly 2 of them have also died. They also said across after visiting various counties within the country, they noted that some counties are suffering, some counties do not have PPEs, including Baringo, and they say they want the government to come in and facilitate these hospitals to have this protective equipment to protect them from infections. And this is what they had to say.
And why we should be able to worry is because we have thrown all the measures, the policies that we have provided, and we are not following them, starting from the top leadership in this country. We are not doing any, and if there is any, it is less than 3%, no contact tracing, including among the healthcare workers, for those who are quite aware on what is supposed to happen. So this is a worry. The number of what we are testing should be able to increase. In the when we get the first case, I think the second week, the country, through the top leadership in the ministry, demonstrated that they can be able to test over 30,000 for COVID. We have never went beyond 10,000. What is lacking? I think this is where now we need to ask whether our resources have been used well. We know there have been reason and our query how our money have been used. So it's good to be told that indeed there is no funding to support even the testing, to ensure that we are having the highest number tested, for us to ensure that we can be able to protect the vulnerable.
Well, beside increasing the number of testing, as George Gibore has indicated, the health clinical officers said that they want the government to give to ensure that medical officers who are pregnant or have pre-existing conditions to be given some off from work, so that to take care of them and to curb the number of infections within the health fraternity. So back to you, Olive. We'll be following up on this on our subsequent bulletins.